Hello, everyone, and welcome to the Global Health Center's Research Seminar Series. My name is Ryan Whitaker, and I will be the host today. We're talking about the data wave in global health and exploring the implications for human rights. We have a wonderful group of panelists today, including Meg Davis, Special Advisor of Strategy and Partnerships here at the Global Health Center. Meg is also the course coordinator at the Geneva Center for Humanitarian Studies. Our second panelist and co-host today will be Carmel Williams, the executive editor of Health and Human Rights Journal. Third panelist, Sharifa Sakala, associate professor, University of Warwick. And our fourth panelist is Shirin Haidari, senior researcher at the Global Health Center and founding president of Gendro. Begin today with a brief note about format. We will not have as formal of a presentation today. Meg has concluded that we are all done with slides for the year. So instead, we will have more of a celebration of the launch of this special issue of the Health and Human Rights Journal. And to introduce the issue today, Meg and Carmel will begin. We will then move to a roundtable discussion, and you are all welcome to share questions and comments in the chat box, and I will be playing question jockey today. So, with that very brief introduction, welcome our panelists to screen and hand the podium to Meg and Carmel to introduce the issue.
That's me, Meg. Okay. Hi, everyone. Thank you very much, Meg and Ryan, for including me and the journal on this occasion. And yes, it's great that we're not doing presentations, we're chatting, we're into December mode. So today is Human Rights Day, everyone. Happy Human Rights Day. And the Health and Human Rights Journal, of which I'm the executive editor, published its December issue today with the special section on big data, technology, artificial intelligence, and the right to health. So I'm very happy to now have that online, and we'll be popping the link to that into the chat box if people want to have a look at it. Meg asked me to have, to say a few words about how this special section came about, and really it came about because I also work as a researcher on a big data and human rights project with the University of Essex and the Human Rights Centre there. It's a large project with several streams on it, and I'm in the health stream, right to health stream. And I've been working on this different pieces of research for about 5 years. So it's a topic that's quite close to my heart. But when I first started the work with the University of Essex, I was really particularly interested in working and continuing work that I had been doing for many years, and it included my PhD research and work within NGOs around the Pacific and global health, and looking at really aid-funded projects and how they should be, and usually are not, integrated into health systems. So I was quite interested to look at technology and the interest that donors have in technology and technology projects, as you know, and how they're rolling out in low and middle income countries. And that was the work that sort of, I was keen to get to engage with, and have since done some publications. And the perspective I wrote in for the special section includes some of that type of work, looking at how to actually try and integrate technology projects, artificial intelligence projects into health systems. So that's sort of where I first started engaging with big data. And then about 2 or 3 years into the project, so 2 or 3 years ago, one of the sociologists on our research team, Lindsay McGooey, started looking at and talking about data as the new economy and the shifting power relations between governments and tech giants and, the private sector, which, these tech giants were becoming ever more powerful and dominant in the global economy. And I thought this was really, really interesting and really important work. And so I started thinking about those issues almost as another form of colonization, that the tech giants were being the colonizers, that they know the value of the fundamental unit of this new economy, and the rest of us don't. So it sort of brought to mind images of, sort of colonial days when the colonizers would arrive in a new country and the indigenous people didn't operate in the same economy and really got completely screwed by the new system. And they're still, in most countries, still suffering as a result of it. And so I was interested in looking at big data in the same way. And that led to me writing a chapter for a book on human rights and equality with editors Gillian McNaughton and Diane Frey. And when I got the peer reviews back, so I was looking at, sort of this colonization really, and how big data, the impact of this new economy, and what would the impact be on human rights and particularly social rights. And when I got the peer reviews back, they were sort of saying, well, you're not really citing much academic literature here. You're citing the media, and this is reading more, like investigative journalism than it is like an academic paper. And I knew that because actually there was very little to read in the academic literature about social rights and the right to health, and in terms of the impact of big data and artificial intelligence on it. This was, say, 3 years ago, and the media was actually doing a fantastic job of exposing, some incredible relationships between the state and big tech, and failings of sort of data breaches and other. They were sort of warning that actually big data was going down the same path that the pharmaceutical sector had gone, and that it was, big data was using all this data that was being given to it for free, and then basically setting itself up to sell it back to the state. So, it was, we really do have to thank the media for the job they did, and I think alerting, the world to what was going on. And of course, since then, more researchers are looking into it. But for me, it certainly sowed the seed that there was an opportunity here for the journal to really engage with the right to health and big data, and across the board look at some of these issues. Because most of the academic literature in terms of big data and artificial intelligence is very focused on civil and political rights, on these important issues around privacy, around security, and the digital divide and things. But there is all this other stuff that actually we can't afford to ignore, that will have a considerable impact on economic, social, and cultural rights. And in terms of health, ultimately, with the tech giants owning all our data, it raises enormous questions about equitable access to healthcare products coming from the use of big data. And we as individuals have had very little choice but to hand our data over, because we can't function without Zoom that we're all using right now. We can't function without all our other devices. We can't possibly, do our jobs without using these apps. And every time we use them, of course, the tech giants are gathering up all our data because we have ticked the box to say, yes, you can use it. And we don't have really any choice about using it. But our governments, I think, that's another issue. They have actually let us down because they have also given away and data without really understanding how valuable it is and what the future implications of having done so are, which really raises, incredibly important questions about the human rights obligations of the private sector, and the gradual, as we've seen, the gradual handover of power to the private sector throughout the neoliberal project. It has not been accompanied by human rights obligations, and I think right now we're in that position where we must do something about forcing human rights obligations on the sector. So Meg and I thought that these and many other aspects of data would be fascinating areas to explore. And, some of these topics we outlined in our call for papers, which was in 2019. So of course, 2020 came along, COVID came along with it, and everything changed. So quite a few of our papers are addressing issues arising from COVID, which in some ways has brought the focus again back to civil and political rights. But on the other hand, I think it has generally, the focus of COVID and technology has probably raised everyone's awareness of the role that technology and artificial intelligence is now playing in healthcare, and has, brought about open debate. So Ryan is keen for me to wrap up the papers. I think there are 11 papers in all in our special section. Really are a fascinating read. They cover a lot of these topics and more. And, I think overall, would say we need human rights more than ever. It's not, as we say in our editorial, just a cumbersome 20th century structure. It actually has huge importance and application right now in terms of protecting our rights into the future. So I hope everybody has an opportunity to look at the papers, and Meg's going to look now at some of, go into a bit more detail about the articles in the issue. Thank you.
Thanks, Carmel. Great framing of the issues. And I'll keep this brief because I think we really wanted this to be more of an interactive discussion with our authors, two of whom are with us today, and others I think have joined us as participants, so we can have a really nice discussion with everybody. I think as Carmel has said, we started on this before COVID, and I think COVID has only accelerated the shift towards digital technologies. I mean, here we are exemplifying this shift on Zoom. And so as we were thinking about what linked all these different papers together and the viewpoints and columns that are in this collection, it was really an understanding that we've become so integrated with our technologies that we are essentially cyborgs. Like, we are essentially now creatures that cannot really function without phones, laptops. Not all of us, of course, because there is a big digital divide and there are many people who lack access to these technologies. But for those of us who've been privileged to have access, we are now integrated into a world in which it's hard to function without these things. And so what does human rights mean for cyborgs? Do we still need human rights? Is one of the questions we really tried to explore in this special issue. And what does the human rights framework offer us, considering that most of the standards that we are now trying to work with were developed before these technologies existed. So to what degree do they still apply, and are they still useful? And I think we managed to find through the contributions of the voices in this collection that there are some things that the human rights framework really does offer us that we can use as tools for advocacy and governance, and for thinking about how to manage and rein in some of the risks and threats that these technologies pose, but also some gaps and some areas where we need more thinking and more work to be done to develop the human rights tools and frameworks to become more effective as tools for governance. So we have articles such as work by Lisa Cosgrove, Amy Dickens, Rajat Khosla, looking at some of the threats in both the design and the use and application of digital technologies in health, including malicious targeting, the surveillance capitalism that Carmel has talked about a bit, the role of public-private partnerships, state surveillance, expansive state surveillance, and some of these concerns. Sharifa Sekalala, who's with us today, led an important contribution on thinking about how to assess state surveillance used in health, and how the Syracuse principles could potentially be used for this purpose. Nina Sun and colleagues look at the role of the International Covenant on Economic, Social, and Cultural Rights. Louise Holly talks about the Convention on the Rights of the Child. But then we have a number of articles also looking at gaps, including work by Akarsh Venkata Subramanian in response to Sharifa and colleagues. Some of my work critiquing WHO and the Global Fund for not developing a shared bottom line on what the human rights risks are and how they should be managed. And then interestingly, as events have developed, two researchers from the Google DeepMind team, from the AI ethics team, contributed an article looking at participatory design of machine learning. And of course, that team has been very much in the public eye as a result of the either firing or resignation of Timnit Gebru, who wrote an important article on environmental impact of language models used in AI. So it was really nice to have this diverse group of voices. And with that, maybe enough from the editors. And let's hear a little bit from the authors who are with us today. And I'd like to start by thinking about some of the concerns that have been raised. And maybe Sharifa, if you would just help us to think through not just the opportunities that digital tools offer health, but what are some of the risks and concerns that your research team identified?
Yeah, so thanks, Meg, and thanks for inviting us to write this really important piece. So at the beginning of this crisis, as global health lawyers, we started to think about the human rights implications of the crisis itself. And one of the main things that we identified was that there was an increased need for public health surveillance, but that public health surveillance would change. It would take a new shape, and it would become largely digital. And that's exactly what's happened. And we wanted to really understand the benefits of public health surveillance in this way, but also to kind of really think about the human rights implications of public health surveillance in this format. Within the context that Carmel has clearly described, you have increased public health, increased private actors in this sphere. The state has become much more marginalized in health. You have an increased digital divide. And so, of course, if you're surveilling the public in a way, in a landscape that's already unequal, you're going to get unequal results. And I think that that's really a problem. So we raise four important concerns for us. So one is efficiency, so the efficacy of these digital tools, seeing that indeed there are some people who are left out of digital health because they don't have access, because we are not sure that the tools work. Lots of them are quite experimental. How effective are they? And are they being sold as tools that are experimental, or are governments telling us that these tools actually work? And I think that that is really important when you think about trust. So if we go into this relationship thinking this will solve all our problems, and actually it never had the potential to do so, or it might, but in 5 years, then we think it's really important that governments are quite transparent about that process. The second thing is we were really also concerned about accountability because of the increased use of third-party actors, and here largely private companies who are manufacturing these tools, who are storing the data. And I think that this is really important because it's often invisible. So for instance, in the UK, we have companies like Amazon or Cytle who are not only collecting the data, but storing it for up to 20 years. And actually what's happening in effect is that people haven't realized. So I talk to my students and I say, do you realize what you do when you use your contact tracing app? And many of them have no idea that they've actually signed away a future use for data that they're giving now. And I think that we think that there's a lack of accountability in this space because many people think that they're engaging with government institutions that, for instance, in the UK, people really love the NHS and they trust it. And so they think this is an NHS app and it's a good thing. And so I think we need to unpick the accountabilities. Who are we giving this data and how are they accountable for that use of this data? The third thing that we identified is that these apps can cause harm. So all these digital tools can cause harm. And this is especially to minority or formerly excluded groups. This might be LGBTQ groups, but this might also be racialized groups within certain contexts. And we need to take that seriously. So for instance, if we are talking about tools that in many instances being part of larger discussions around movement, then actually we might trap people. And we've seen this with ideas around domestic violence increasing, but actually because people have apps, they might feel that somebody knows exactly where they are and they might be unable to leave their house. And also minority populations such as LGBTQ groups who feel that they're being targeted as a result of using these tools. And so I think that that's really a problem as well. And I think the last thing that we were really worried about, so we're really worried about two things that are quite interconnected. One is that there's just really a worry that something that's begun as something for a current crisis, which is the COVID-19 crisis, will never stop. And so just like the war in terror, where we took a lot of other things that had happened as a result of that, that we might just remain with these digital surveillance tools because people think, well, we can collect all this data, it's effective for all these other functions, and they will become contingent on things like employment, welfare, on housing. And actually, we think that this is a real concern for privacy in the future, but is also problematic for democratic societies. And then we also thought about how actually the idea that when these things become embedded, they lose their original purpose. So if something began as a public health surveillance tool, it's losing its original purpose. And we are having lots of add-ons on asking people to do extra things as part of these digital surveillance tools. And this is really bad for trust. So a major argument is that this is really bad for health systems because then people start to think about these tools not as things that help health systems, but as things that just help the state to do what they want to do. And I think that for those reasons, we really think that it's imperative to think of human rights in this space because human rights help to hold somebody accountable. So you create accountability mechanisms, but also I think that they re-engage the public and help us to have trust in the system. And that is so important for health measures as we've seen this year with the COVID-19 crisis.
Wow, that is really rich. Thank you. And I love the thinking about human rights, not just as a tool for restraining these technologies, but as a tool for public engagement. But I just want to come back to one of the points you raised, which is about the disproportionate impact that some of the negatives, some of the downsides of digital technologies and AI has on certain communities. And so that this is not something that is, sort of a flat impact, that the existing inequalities that we have in our societies already can be magnified and amplified in terms of the data and the abuses that can be done with the data and the technology. And so I just wondered, Shireen, if you, given your work on gender and data, if you wanted to amplify or come back to some of the things Sharif has raised.
Great. Thank you so much. First of all, it's great to be here with you all. And thank you, Sharifa, for really great insights. I think what we try to do in our paper is really drawing, as Meg mentioned, to the concerns around the biases in data that shapes these algorithms, the AI systems, and the digital technologies that can actually reproduce and reinforce gender inequalities, inequities, and really deepen health inequities at large. I mean, we know that digital technologies have really great promises and can have power to protect and improve health and well-being. They can be very useful for public health purposes. As mentioned before, it can help actually introducing interventions that can be tailored to the need, identifying health disparities, and also identifying gender-related barriers if we have the right representative set of data that can inform these algorithms. Unfortunately, these days, algorithms that are used are often drawing on biased data. And of course, machines learn from humans, and we humans are biased. So the data that we collect and we use to build these technologies becomes inherently biased. And we have seen, for example, a persistent gender data gap, where we do not adequately capture gender and other diversity dimensions. And as such, it results to misinformed algorithms, predictive models, a surveillance system that really doesn't capture the realities, the needs, and the diversity of our societies. And again, as a result, these are used to inform public health policies, both at national, local, and global level. It can inform the public health interventions, health financing, health system, and as such, again, can further magnify and amplify health inequalities. And again, not to mention, as raised before, that again, these technologies can benefit those that have access to digital devices and internet connectivity. And let's not forget that we have a major digital divide, not least a gender digital gap as well. And again, you know, with the strive to also advocating for more granular data, we're also mindful that there are, of course, risks around the human rights violations, breach of privacy, but let's not forget that these are not mutually exclusive. We can collect better data, more disaggregated data, while at the same time doing it responsibly, ethically, with respect for privacy and human rights. And that really requires a more participatory and inclusive approach.
Thanks, Shireen. And I see your co-author is among the attendees, Heather Doyle, so I hope she'll also chime in. I just wanted to make a plug again for people to type in questions or reactions in the chat so we can make this as participatory as possible, and pass the baton to Carmel, who has the next question. Carmel, you're on mute.
Yep, sorry, I've muted. A question has just come in. Okay, it's quite a long one. I was reading it to see whether we want the panelists to answer this at the moment. It's how to deal with the tension between the full integration of digital health and national public health systems and policies and the tendency towards surveillance states, because we need the state as a regulator, etc. I guess that sort of in ways leads to this other question that I was wondering about in terms of how the past year has actually changed your assessment, Sharif, around digital public health surveillance, and whether was this something you were looking at prior to COVID, or is it just COVID that has drawn your attention to this? And perhaps also thinking around that tension between digital health and governments, really, yeah.
Yeah, so thanks very much, Kamel. And it's a really fantastic question. So before the COVID-19 crisis began, I just began a project which has gone somewhat delayed because of the COVID-19 crisis. And it's on health apps in sub-Saharan Africa, which there's this idea that health apps are going to be this huge thing that are going to be amazing for universal health coverage. And we were interested to kind of think about the regulatory landscape within which they were operating, because of course that's quite different. But also the idea of regulating something that changes very quickly. And that's in some ways the tension that you have with public health surveillance in terms of trying to regulate something where you might need data that you don't know yet that you need. And I think that states struggle with this, but I think that there are ways of trying to think about this aspect. So for instance, is this data all necessary? Should we be collecting it? So there's always kind of a knee-jerk reaction that we should collect the data because we can, because it's easy, and so therefore we should have it. And I think governments need to ask themselves whether all this data is necessary. One, because you also need to store it. And then there are like add-on effects in terms of storage, environmental impact of these huge servers that are trying to store this data, dangers of it being stolen in the future, of it being mined. And so I think we need to seriously ask ourselves how much data we need in order to solve some of these fundamental problems. Because when you think about most crises in health, they're very elementary problems in most health systems. We are not vaccinating children. We're not giving children food in schools. So these are kind of basic problems, but we have somehow moved from these really basic problems to do with public health systems and convinced ourselves that we need some high-tech digital solution that is tailored to every individual. And we do need some of those. We will need some kind of personalized treatments for some cancers. But actually, if you think about kind of cohesive health systems, the greatest good would be done by ensuring that all children are fed in schools, by ensuring that we have better sex education. Those things will have much more value inherently than a lot of these things that we're thinking about. So necessity for me, which is one of the things that we talk about in our paper, becomes a really huge test there, but also proportionality. What are we getting for kind of this massive accumulation of data, besides the fact that some private companies think it's a good thing? And as societies, we should start having these conversations, both within kind of European and North American societies, but also within societies where we are pushing them as part of universal health coverage.
Thank you. That is a great answer, and I think one of my own research interests along those lines, as well as these apps, that the health apps that are really being sort of encouraged through the AI for good, the UN agencies movement to provide apps into low and middle income countries. They can be great apps, but what is the point of diagnosing breast cancer or skin cancer if in fact you don't have any treatment options available for people? But as you say, the data that is collected from them may be no use at all to that particular country, but it is absolutely valuable to the tech giants who will be training, their machine learning opportunities to further detect, to have machine learning options for breast cancer detection or whatever. So it does come back to, the need for governments to be ahead of the game. But my sense is that they are not at all.
I think this is, yeah, thanks. I think this is so we're really getting down to brass tacks, because I think this is really, there's really an intersection of financial interests that are driving this drive for data. And I think, first of all, this growth of public-private partnerships, all the excitement around partnering with the private sector in an environment in which there's less and less money available for health, is in part driven by the fact that tech companies face restrictions in accessing large data sets in the global north, but less restrictions often in low and middle income countries.
Yes.
And therefore there's an interest in forming these partnerships that are, ostensibly philanthropic, but actually give them access to large data sets that would be more tightly regulated than in a place that, like Europe, that's governed by much more restrictive regimes. And I also see a huge risk of, with all the excitement around digital technologies, that we start to funnel a lot of money into very expensive and sometimes unproven interventions and leech it away from interventions for which there is strong evidence. And I'm thinking in particular in the HIV sector of harm reduction, where there's a vast amount of evidence, but it's chronically underfunded. And now all of this money may be going into digital technologies that, don't save lives in the way that harm reduction is proven to do. So yeah, very, very concerning.
Meg, can I add, also thank you so much, Sharif, and Carmel and yourself, Meg, great points. I want to come back to the point that Sharif raised around necessity of data, and I think that's a really valid point. And it comes back to the issues around collecting the right data, the granular data as well. That most of the times these data are collected, they're not even used, and I think that's even a bigger concern, that we are collecting data that could potentially have a benefit and a purpose, but we are actually totally ignoring them. And I think that comes back also to the issue that evidence is political. At the end of the day, it is a political decision and a subjective decision what data we use, what data we analyze, what data do we use to inform our policies and responses. And I think, a way that what we, Heather and I, propose in our paper is really maybe a participatory approach, engaging communities can address some of these issues, that we're not only collecting data that is scientifically justified, but data that also the community sees as relevant and important to them, and that the finding out of those data could actually be beneficial to the community, but at the same time also engaging them to make sure that the process of data collection and analysis and use are ethical, it is acceptable from their point. And I think that in itself can also increase potentially public trust around the quality and the relevance of these data, and also hopefully the use of data in a more meaningful way.
Along those lines, I think one of the really hopeful developments in the past year has been the Black Lives Matter movement. And I think we're seeing more mobilization and more public discussion about these kinds of inequalities and how they shape data. And I just wonder if, is this changing the way that data is going to be gathered and regulated? Are we at that point yet, or are we not yet at that point at which we see this kind of mobilization changing data gathering practices? Oh, Sharif, yeah, go ahead.
So my sense actually is that we haven't joined up those dots. So we're having that discussion and it hasn't really joined the data discussion as yet. And actually that is a problem. And it's a real problem with COVID-19 because of course we now have the data to show that some groups, and that was racialized, had much worse outcomes. But that hasn't really kind of sipped into the ways in which we make decisions. So as Shireen says, these are political choices. And actually the politics of that hasn't really linked up to the kind of data that we're collecting or how we're using it. And all it is kind of studies that seem to target groups, but also my worry within this area is that what we are having is fragmentation. So people who mean very well are doing studies with these groups and collecting some data, but the state as an overarching regulatory being is not doing that. And what you're having with groups who are vulnerable is fatigue because they feel overstudied, but actually that doesn't link into public health policy in any way. So you're having kind of, in the UK, for instance, Imperial sending groups and saying, well, you're underrepresented and we want to hear from you and have this up. And then you have Kings sending you the same email. And then it just kind of doesn't link up, because when the health interventions come, the state is not really thinking about your group in any meaningful way. And so that creates problems, and you're going to start seeing it. So there was a really brilliant piece that I read yesterday about vaccine hesitancy amongst racialized groups. And this is because there is this mismatch, but also a lot of fragmentation that is taking place. And actually, if we then take human rights seriously, the state is the actual provider of the right to health. And we should have less fragmentation by individual research groups and more action by the state in order to kind of collect all this data. And as Shireen says, in order to ensure that it's being used and links into that policy bit, which I think would be really helpful.
Yeah, great point. I mean, we're dealing in many cases with states that can't even coordinate their response to COVID. So yeah, but I agree that makes sense in terms of the focus. I I see we have some questions coming in on chat, but I haven't seen what they are. I don't know if Carmel or Ryan wants to call one out.
Can I add to Sharifa's point, just make very briefly? And I think that's a really good point. And one of the very clear examples that I think has linked really the fragmentation and the bias of data to the issues raised by the Black Lives Matter is really the racial biases in digital technologies, as we have seen with the voice recognition technologies and the facial recognition technologies. And these technologies are being used more and more by police and law enforcement, and has really resulted in, increasing abuse and xenophobia and racism, knowing that facial recognition doesn't actually work equally well with those with the darker skins or with women as much as men. So these are really big concerns that I think really brought to light with Black Lives Matter movement as well, which I think is really important to address.
One of the questions that has come in asks whether there has been much discussion in the human rights community of framing big data as a public good, especially with the power to influence and shape other public goods and being regulated as such. I think there has always been in public health the use of data for, sort of epidemiology, and I don't think anyone doubts that big data, can have good purposes when it's, granulated data sets can identify small marginalized groups that are missing out on healthcare and so on. But I think in the sense of big data and artificial intelligence, probably one of the things that comes through in all our papers is the inherent belief that overall big data has a lot to offer health. Look at the speed at which the vaccine for COVID is coming together. I think that raises, an awful lot of questions, but a lot of that speed has been because huge data sets have been, sort of involved in the process of identifying, whatever makes vaccines work. But you can't, we have to look at it as an entire human rights issue, and it will not just be a good, they're a public good. We do have to ask who will have access to it, and I think that that perhaps the other panelists would like to chip in on that.
I know I would. I think there's been actually quite a bit of debate about this idea of data as a public good, because it then exposes the risk of data being sucked up, hoovered up by private interests. And so I think, I know that IDARE, I don't know if anyone from IDARE is on in the list of attendees today, but their initiative based at the Global Health Center, where Shireen and I work, which is trying to promote collaboration among countries and among other partners in development of digital technologies for health. But they've been pretty clear about the fact that they want to see data continue to be regulated at the local level. And I think data as a public good can sometimes be code for data extraction. So I think we have to be careful there. But I don't know if Shireen or Sharifa want to come in on this point.
No, I think this is a really important point. And I really like the idea that Carmel brings up around the human rights connection to data. And I think it's an exciting time for human rights as well. I think the digital technologies, with all its pitfalls, it also allows us to really mobilize across the globe and raise these issues as we are doing now. And it's then also an opportunity for us to really fine-tune the applications of human rights to the contemporary needs of our digital world. And I think the human rights-based to data that has been published recently is one of those examples that really brings to light the issues of, the making invisible communities that are not captured by data, at the same time raising issues around the privacy and human rights aspect of data. And I think that's where the conversation should go, that these issues should go hand in hand.
So I guess my sense would be to turn it around. If you think about a public good, what would we expect in a public good? So would expect that would all have access. If indeed it was a public good, then there might be some requirements of what this public good looks like. And so we would all want to have access, and this access would be equal so that we could all benefit from it. And that might be one way of thinking about it. Would expect it to be transparent because it is public. So would expect to have accountability mechanisms because, again, it's in the public interest. So all other public processes would have those ingredients. But it seems to me that at the moment, big data doesn't. And so in terms of the framing, perhaps those are the questions that we need to be asking of this public good, that what are the things that we would need for it to have in order for that to be indeed a truly public good, non-discriminatory. So those would be kind of some of the things that we would demand if big data was a public good, but we know that it isn't. And so perhaps it's a reshifting and making those demands of states in order to ensure that that's the case.
I know there's more questions coming in on chat, and Ryan has one he wants us to tackle, which we can do. But I also wanted to come back to this question of what the human rights framework offers us as we begin to look forward, because I realize we're going to run out of time soon. And I'm thinking in particular of governance of partnerships with the tech sector, which has come up a couple times already. So we have the UN Guiding Principles on Business and Human Rights, the RUGI framework, which identifies state duty to protect and corporate responsibility to respect human rights and effective remedies for victims. And I just wonder, for Shireen, Sharifa, Carmel, do you see that this is robust enough? Do you think that there's need for more stronger human rights tools, or do we have enough of what we need already in terms of existing normative frameworks?
Well, I'm happy to answer quickly and briefly that I think, you know, the RUGI framework is a good start, but, you know, as Anand kept repeating last night in another webinar, it's only ever, you know, recommendations. There is no legal obligation of the business sector to you know, protect, respect and fulfill human rights. So I think that we absolutely need not new human rights per se, but we need accountability measures and obligations to absolutely become legally required of the private sector. I think it's essential and needed yesterday, really.
So I think that the RUGI principles are still in some ways quite weak because, as Kamel says, it's just recommendations. But I think the other problem with them is that in some ways, the people that are being accountable are framing the debate. And I think we need to demand more in terms of them ensuring that their tools are really necessary, that they meet legal requirements, and that they're proportionate in the ways in which they're being designed. And I think that there is some work to be done there on how different this is in terms of digital rights. So I think there's been a lot of work, for instance, fantastic work on extractive industries and how that process would work along all lines of the supply chain. And I think as a human rights community, there is some work here with digital tools in terms of rethinking how we make those better standards that can fit within this framework for digital tools.
Thanks. We've talked a lot about the ways that the grab for data has been intrusive and we need protections to ensure equity. But Moira Fall has asked a question also about the data that is systemically missing and those implications for equity. For example, in the SDG indicators. Would any of you like to address that?
Well, I wrote a book about it. I think there's a huge tension. I'm not going to re-summarize the whole book, but I think there's a huge tension between the need for data to set priorities and to make equitable decisions about priorities in ways that are transparent and accountable, and the tension around the need for privacy and the need for protection against the malicious use of that data, and especially the use of data of marginalized and criminalized groups in countries that can potentially use the data to identify people for arrest or who could engage in discrimination in different ways. And so one of the solutions, I think, is and it's easy to say and hard to do, but I think one solution is to shift the lens towards community-led efforts to gather data. And I think that's something also that Shireen and Heather addressed in their columns. So maybe I'll pass to Shireen if she'd like to talk a little bit about solutions and ways forward.
Well, thank you so much. I mean, I think given the issues related, particularly in making invisible some groups, we have been drawing from the wealth of the feminist scholarship on issues related to gender equality, social justice, and equity at large. And again, the feminists have a long stride for social justice, address power hierarchies and dynamics, and kind of this approach seems very suitable for the issues that we are dealing with, to making sure that experiences, voices, realities, and bodies of women and other marginalized groups are taken into account. And importantly, really reflecting on the influences of our decisions and our subjectivities and bias and the process of data collection, on the knowledge production as such, about the decision we make around, what data to collect, how to analyze them, how to use them, and making sure that these processes are participatory and includes the active participation of women and marginalized community and underrepresented groups, to make sure that, what we are using and we are collecting is done in a responsible way, in an ethical way, in line with human rights principles, and also beneficial and relevant to the use of community. And I think that's where the huge gap is, that these days the data are actually collected by huge companies or institutions with very little engagement with communities and those who are providing data. And as such, there is a large kind of gap, and also builds a mistrust about where these data goes, who is using them. And often some of these are not even used properly. So I think, bringing all of those principal values from the feminist scholarship and the feminist movement will bring a lot of advantages to thinking about global health data and big data, even small data as large, and research and knowledge production as such.
Okay.
Approaches, inherently also, anti-racist and kind of really embraces decolonial approaches, which I think is also importantly and timely as these conversations are beginning to surface.
I think Sharifa was just going to come in there.
That's going to come in, and it chimes in with a question in the chat about whether the individual is the focus of human rights. And I think that actually we have created this idea of the individual as the focus of human rights, but the entire body of economic, social, and cultural rights is not towards individuals. Individuals are only a small aspect of that. It's really communities. So when you think about the right to health, yes, I can give one person their right, but it shouldn't be at the expense of other people's rights. So you need entire communities to be healthy. And in some ways, actually, I think that the current COVID-19 crisis has made this really evident, that people who thought, well, I will just, go to my country house, you will get stuck there because you need the entire community to be healthy. And so I think we need, in some ways, to reset that relationship as a human rights community, to start thinking of those social rights really as community rights. And I think that that is really vital, but we already have the framework to do so. So that's the good bit. We already have the framework and the tools to do so. We just need to kind of have those conversations and that reimagination to begin.
Beautifully said. Really nice. Thank you.
So prior to COVID, we were in, there were some quarters, I guess, who were suggesting that human rights were, the end of human rights was nigh. And just wondering, sort of in light of what you were just saying, Sharif, perhaps this awareness now of that each of us belongs to a community. Do you think that actually that's you know, that the need for equity, the need to protect the most vulnerable, has actually come out so strongly this year that maybe it's maybe this will all work out well for human rights. Maybe people will realize that we're, you know, we are all in this together, and it's not just about civil and political rights. We don't achieve our economic, social, and cultural rights if you know, if we don't have all our human rights met. And to do that, you know, we do need to be looking after the most vulnerable, the most marginalized people. So is it, you know, is the end of human rights now?
I kind of feel quite optimistic about human rights, because I think one thing that this crisis did was that inextricable link between different human rights. So we had kids who were not going to school, and we are suddenly having conversations about what our priorities were. So should shops open before schools? And do we have kind of human rights obligations, and also reframing those as moral obligations? And what rights these children had. We've had conversations about homelessness in societies, because we realized that these were weak links that would cause the virus to spread. We've had conversations about whether our health systems were prepared and what that means if they're not. And I think it's stopped being a very kind of strict, this is just an economic argument. We can't keep giving money to health and budgets can't keep increasing, to realizing that the other things that we thought were valuable, the kind of the shops, the things that were going to kind of make big businesses massively productive, are not possible without kind of the humans. And that's where rights come in. So we need the humans to be healthy, and for these humans to have their rights, in order to make our societies the greatest or the most productive, whatever you might think about that. So I personally think we should slow down a bit. We should remain slow, but that's another conversation for another day. But I think it's made me incredibly hopeful, because we've at least had those conversations again about fairer societies, more equitable societies, but also where human rights fits within that conversation.
Thank you.
Shireen, any concluding thoughts? Or I think we're being told that we're out of time.
I totally agree with Sharif, and I'm also equally optimistic. I'm optimistic by nature, but I also think it's an optimistic time for human rights as well. And I think, you know, the COVID-19 has also brought to light some issues that we had perhaps not paid attention to before. And it really has catalyzed the conversations and brought issues related to gender, racial justice, social justice, and human rights together in the global health field in a way that we perhaps haven't seen it before. So I'm hoping that these conversations continue, and we also kind of really refine and fine tune the human rights principles to better apply our needs.
Okay, well, I was meant to provide some concluding comments, but I think we're just about out of time. I think it's been a really rich conversation. Thank you so much, Sharif and Shireen, as authors to the issue, for joining us. I hope everyone does take the opportunity to read the papers in our special section. You know, the conversations we've just had are expanded, and there are other topics as well. So thank you all very much for joining us. And on Human Rights Day, I'd just like to say, long live human rights. Okay.
Thank you all for joining us. Thank you to our panelists for wonderful contributions. This was our final event of the current semester. We will be back in the spring for more content. We encourage you to view our list of upcoming events, join our mailing list, and you can also see past seminars on our website. So that's all for today. We will see you soon. Thanks.
Thank you.
Everyone.
Thank you.
Bye-bye.
Bye.
Bye.